oftentimes actually people come to their first therapy sessions and they're actually terrified. They're terrified of the whole process because they don't know what to expect. They have seen all these different things on TV and all these people, even people that they've talked to, and they're scared. And that's the first thing that we have to sort of talk about, you know, about what therapy is all about. You know, and that's what makes it so hard. I mean, it takes such courage for people to come into therapy to start, because they actually don't. All they know is that they're hurting, and they're not coping, or they're, you know, whatever is going on in their life. They know that, and they know they need help. But so they come to the therapy room. Actually, I feel not quite knowing what to expect. You know,
they're asking the psychotherapist sometimes, "Can you make me feel right?" Well, we can't make anybody feel anything. What we can assure them is that we will be actively listening, we'll be spending that amount of time with them, and they can expect that the next time they come, they have a confidential place to be able to talk about the issues that are plaguing them.
the other thing that you should expect, I think, is a plan of therapy, as it were, and somebody to ask you how you're feeling, you know, how you feel the therapy is going, and that you know where it's headed, and you're okay with it, and you're in agreement with it. You've worked together, and at the end of the day, it's your plan, and the therapist is facilitating that plan.
That plan can change. So that is also something that we try to explain, certainly during the first session. Sometimes, you know, the best laid plans, you've discovered actually with a new piece of information, that particular plan isn't going to work. We're going to have to try something new. And so when they come in, they'll have a comfortable place to sit, they'll be cared for, they'll be listened to. They will be the only ones talking. This is not a discussion with a friend. This is not a discussion with a family member. This isn't trying to take care of other people in the moment. This is completely, thoroughly about them. I find too that oftentimes what they think they're coming in for isn't at all what they're really coming in for, what they say they are. It's really interesting, and I'll give you an example of that with a client I had once without any identifiers, and changing the story somewhat, but just to illustrate the point. The person came in and told me that he absolutely wanted to learn how to play basketball. And clearly I'm not a basketball pro. This isn't probably where he's going to get that. What he really wanted to know was he wanted to be able to play basketball. It ended up becoming a situation in which it was clear that he was having difficulties making connections with social groups. So again, it does often come down to that inability and that vulnerability when it comes to making connections with people.
Because often people will sit opposite me and say, how are you going to mend this? And I have to straight away fire back to them, I can't, but what I can do is help you to work through some issues. And I think that's really an important part of the initial sessions.